Are new antibiotics changing bacterial STI treatment? Imagine a world where fighting bacterial sexually transmitted infections becomes easier and more effective. Well, recent developments suggest that new antibiotics are indeed poised to make a big difference, especially for gonorrhea, which has become increasingly resistant to traditional drugs. Gonorrhea is one of the most common bacterial STIs worldwide, and over the years, the bacteria that cause it, Neisseria gonorrhea, have developed resistance to many antibiotics used in treatment. This resistance has made managing the infection more challenging and has created an urgent need for new options. Currently, the standard treatment for gonorrhea involves an injection of ceftriaxone, often combined with a single dose of oral azithromycin. But with the bacteria becoming resistant to these drugs, scientists have been working on new antibiotics that can stay ahead of the bacteria's ability to adapt. Two promising oral antibiotics are zoliflodacin and gepotidacin. Zoliflodacin is a first-in-class drug that has shown strong activity against resistant strains of gonorrhea. It is designed to be taken as a single dose, making it easier for patients to complete treatment. The U.S. Food and Drug Administration has already accepted its application for approval, and if approved, it would be the first new antibiotic for gonorrhea in many decades. Gepotidacin is another innovative oral antibiotic that works by blocking bacterial DNA replication. It has demonstrated cure rates of around 93% in clinical trials, which is comparable or even slightly better than current treatments. The FDA has approved gepotidacin for urinary tract infections and is reviewing it for use against uncomplicated gonorrhea. A decision is expected by late 2025. The advantage of gepotidacin is that it can be taken orally, potentially replacing the need for injections in some cases. These new antibiotics are exciting because they offer oral options at a time when resistance is spreading globally. However, experts warn that gonorrhea has a long history of developing resistance to every antibiotic used against it. This means that ongoing surveillance and responsible use of antibiotics are essential to keep these new drugs effective. It's also important to remember that antibiotics are just one part of STI management. Safe sex practices, regular testing, and prompt treatment remains key to controlling infections. In addition, some strategies like doxycycline post-exposure prophylaxis have shown promise in reducing certain STIs, but they also raise concerns about contributing to resistance in other bacteria. So, while these new antibiotics are a step forward, they are not a cure-all. Continued research, careful stewardship of antibiotics, and personalized medical care from healthcare professionals are crucial. Until these drugs are fully approved and integrated into clinical guidelines, established treatments will remain as the mainstay. Remember, practicing safe sex and getting tested regularly are the best ways to protect yourself and others from bacterial STIs.